So today I thought I'd do something slightly different because obviously studying and working, it all causes quite a few problems with sort of mental health. So I think it's really important to look after your mental health and make sure you're putting yourself first. So I was going to read a little section from a mental health first aid book just about anxiety problems, which is something I know a lot of people really struggle with. So, what are anxiety problems? Everybody experiences anxiety at some time. When people describe their anxiety, they may use terms such as anxious, stressed, uptight, nervous, frazzled, worried, tense, or hassled. I think it's something we all feel, isn't it? Although anxiety is an unpleasant state, it can be quite useful in helping a person to avoid dangerous situations and motivate the solving of everyday problems. Anxiety is mostly caused by perceived threats in the environment, but some people are more likely than others to react with anxiety when they are threatened. Anxiety can vary in severity from mild uneasiness through to a terrifying panic attack. Anxiety can also vary in how long it lasts, from a few moments to many years. Anxiety problems differ from normal anxiety in the following ways. They are most severe, longer lasting, and interfere with the person's work or activities or relationships. Anxiety can affect someone's thinking, feelings, behaviours, and their physical well-being, as shown in the box below. So these are some of the signs and symptoms of anxiety. So thinking, which is when your mind's racing or going blank, decreased concentration and memory, indecisiveness, confusion, vivid dreams. Feelings, unrealistic or excessive fear and worry about past and future events, irritability, impatience, anger, feeling on edge and nervousness. Behaviour, avoidance of situations, obsessive or compulsive behaviour, distress in social situations, sleep disturbance, increased use of alcohol or other drugs. Physical, pounding heart, chest pain, rapid heartbeat, blushing, rapid shallow breathing, shortness of breath, dizziness, headache, sweating, tingling, and numbness. Choking, dry mouth, stomach pains, nausea, vomiting, and diarrhea. Muscle aches and pains, especially neck, shoulders, and back. Restlessness, tremors, and shaking. All pretty serious stuff, really. So what are anxiety disorders? People with anxiety problems may be diagnosed with different types of anxiety disorders. These disorders differ from each other by types of situations or things that the person feels anxious about, and by the sorts of beliefs they have that exacerbate their anxiety. The main types of disorders where anxiety is a major feature are post-traumatic stress disorder, social anxiety disorder, or social phobia, agoraphobia, generalised anxiety disorder, panic disorder, and obsessive compulsive disorder. It is not unusual for a person to have more than one of these disorders. The table below shows how common each of these is. Anxiety disorders affects around 14% of the population aged 16 to 85 years in a given year, and are more common in females than males. The median age of onset is 11 years, which means that half the people who will ever have an anxiety disorder will have an onset by this age. Anxiety disorders often co-occur with depression and substance use disorder. So post-traumatic stress disorder, or PTSD, can occur after the assault, including physical or sexual assault, mugging or robbery or family violence, and witnessing something terrible happen. Mass traumatic events include terrorist attacks, mass shootings and warfare. A major symptom is re-experiencing the trauma. This may be in the form of recurrent dreams of the event, flashbacks, intrusive memories, or unrest in the situations that bring back memories of the original trauma. There is avoidance behaviour, such as persistent avoidance of things associated with the event, which may continue for months or years. Also, persistent symptoms of increased emotional distress occur. Constant watchfulness, jumpiness, being easily startled, irritability, aggression, insomnia. The person may also overly blame themselves or others, show reduced interest in others and the outside world, and may not be able to fully remember the event. It is common for people to feel greatly distressed immediately following a traumatic event. If their distress lasts longer than a month, they may have post-traumatic stress disorder. Only some people who are distressed following a traumatic event will go on to develop a mental illness, such as post-traumatic stress disorder or depression. Social anxiety disorder, social phobia. This involves extreme discomfort or fear in a variety of social situations. Commonly feared situations include speaking or eating in public, dating and social events. These are situations where public scrutiny may occur, usually with the fear of behaving in a way that is embarrassing or humiliating. The key fear is that others will think badly of the person. The anxiety about social situations must persist for 6 months or longer. Social anxiety disorder often develops in shy children as they move into adolescence. General anxiety disorder. Some people experience long-term anxiety across a whole range of situations, and this interferes with their life. These people have generalized anxiety disorder. The main symptoms of generalized anxiety disorder are overwhelming, unfounded anxiety and worry about things that may go wrong or one's ability to cope, accompanied by multiple physical and psychological symptoms of anxiety or tension occurring more days than not for at least 6 months. People with generalized anxiety disorder worry excessively about money, health, family and work, even when there are no signs of trouble. The anxiety appears difficult to control. Other characteristics can include an intolerance of uncertainty, belief that worry is a helpful way to deal with problems, and poor problem solving. General anxiety disorder can make it difficult for people to concentrate at school or work, function at home, and generally get on with their lives. Panic disorder. Some people have short periods of extreme anxiety called a panic attack. A panic attack is a sudden onset of intense apprehension, fear or terror. These attacks can begin suddenly and develop rapidly. This intense fear is inappropriate for the circumstances in which it is occurring. Other symptoms, many of which can appear similar to those of a heart attack, can include a racing heart, sweating, shortness of breath, chest pain, dizziness, feeling detached from oneself, and fear of losing control. Once a person has had one of these attacks, they may often fear another attack and may avoid places where attacks have occurred. The person may avoid exercise or other activities that may produce physical sensations similar to those of a panic attack. It is important to distinguish between having a panic attack and a panic disorder. Having a panic attack person with panic disorder experiences reoccurring panic attacks for at least 1 month and is persistently worried about possible future panic attacks and the possible consequences of panic attacks, such as fear of losing control or having a heart attack. Some people may develop panic disorder after only a few panic attacks, while others may experience many panic attacks without developing panic disorder. Some people with panic disorder also develop agoraphobia, where they avoid places where they fear they may have a panic attack. Agoraphobia. A person with agoraphobia avoids situations such as being outside of the home alone, using public transport, being in either open spaces, e.g. a parking lot or bridge, or in an enclosed space, e.g. a shopping mall or a theatre. The focus of the person's anxiety is that it will be difficult or embarrassing to get away from the place if a panic attack or other embarrassing symptoms occur, or that there will be no one present who can help. Although agoraphobia can occur without panic attacks, this is less common. Obsessive compulsive disorder, or OCD. This disorder is not common, but is very disabling. Obsessive compulsive disorder often begins in adolescence and may be a lifelong illness. Obsessive thoughts and compulsive behaviours accompany feelings of anxiety. Obsessive thoughts are recurrent thoughts, impulses and images that are experienced as intrusive, unwanted and inappropriate, and cause marked anxiety. Most obsessive thoughts are about fear of contamination, symmetry and exactness, safety, sexual impulses, aggressive impulses, and religious preoccupation. Compulsive behaviours are repetitive behaviours or mental acts that the person feels driven to perform in response to an obsession in order to reduce anxiety. Common compulsions include washing, checking, repeating, ordering, counting, hoarding, or touching things over and over. Specific phobias. A person with a phobia avoids or restricts activities because of fear. This fear appears persistent, excessive, and unreasonable. Specific phobias are common, but are less disabling than other anxiety disorders. The person may have an unreasonable strong fear of specific events, places, or objects, and often avoid these completely. The most common fears are of spiders, insects, mice, snakes, and heights. Other feared objects or situations include an animal, blood, injections, storms, driving, flying, or enclosed spaces. Mixed anxiety, depression, and substance use problems. Many people with anxiety problems do not fit neatly into a particular type of anxiety disorder. It is common for people to have some features of several anxiety disorders. A high level of anxiety over a long period will often lead to depression, so that many people have a mixture of anxiety and depression. People with anxiety disorders frequently use substances as a form of self-medication to help cope. This can lead to substance use problems. Furthermore, heavy use of alcohol and drugs can lead to increased anxiety. Risk factors for anxiety disorders. People most at risk are those who have a more sensitive emotional nature and who tend to see the world as threatening, have a history of anxiety in childhood or adolescence, including marked shyness, are female, misuse alcohol, experience a traumatic event. some family factors that increase risk for anxiety disorders. A difficult childhood, for example, experience emotional, physical, or sexual abuse, neglect, or over-strictness. A family background which involves poverty or a lack of job skills. A family history of anxiety disorders, parental alcohol problems, separation and divorce. Anxiety symptoms can also result from some medical conditions such as hypothyroidism, arrhythmias, respiratory conditions such as chronic obstructive pulmonary disorder, metabolic conditions such as vitamin B12 deficiency, side effects of certain prescriptions and non-prescription medications, intoxication with alcohol, amphetamines, caffeine, cannabis, cocaine, hallucinogenics and inhalants, withdrawal from alcohol, cocaine, sedatives and anti-anxiety medications. Some people develop ways of reducing their anxiety that cause further problems. For example, people with phobias avoid anxiety-provoking situations. This avoidance reduces their anxiety in the short term, but can limit their lives in significant ways. Similarly, people with compulsions reduce their anxieties by repetitive acts such as washing hands. The compulsions will then become problems in themselves. Some people will use drugs and alcohol to cope with anxiety, which can increase anxiety in the long term. Interventions for anxiety disorders. Professionals who can help. A variety of health professionals can provide help to a person with an anxiety disorder. GPs, psychologists, mental health nurses, counsellors, psychiatrists, occupational therapists and social workers with mental health training. More information about these professionals, how professionals can help, is available in section 1. If the person is uncertain about what to do, encourage the person to consult a GP first, as they can check whether there is an underlying physical health problem causing this anxiety and refer the person to the appropriate specialist help. Treatments available for anxiety disorders. Research shows that a wide range of treatments can help with anxiety disorders. Psychological therapies. Various psychological therapies are used for anxiety disorders, but the following have the strongest evidence for effectiveness. Cognitive behaviour therapy is the best treatment for anxiety disorders of all types. It involves working with a therapist to look at patterns of thinking, cognition, and acting behaviour that are making the person more likely to have problems with anxiety or making their anxiety worse. Once these patterns are recognised, then the person can make changes to replace these patterns with new ones that reduce anxiety and improve coping. To get the full benefit of cognitive behaviour therapy, a person needs to have a sufficient number of sessions. Behaviour therapy, also known as exposure therapy, is often a component of cognitive behaviour therapy. It involves exposing the person to things that might make them anxious. The person might be exposed to feared situations in real life or in imagination, usually in a gradual way. This type of therapy teaches the person that their fear will reduce without the need to avoid or escape the situation, and that their fears about the situation often do not come true or are not as bad as they thought. Self-help books, which are based on cognition behaviour therapy or behaviour therapy, can be These are more effective when used under the guidance of a health professional. Computerized therapy is self-help treatment delivered over the internet or on a computer. Some are available for free. These are more effective when used under the guidance of a health professional. Medical treatments. Significant evidence support the effectiveness of a number of medications. Antidepressant medications are effective for most anxiety disorders as well as for depression. Other types of medication can also be a help, particularly for generalized anxiety disorder. These include benzodiazepines, anticonvulsants, antihistamines, antipsychotics, and, pardon me, I don't know how to say this word, azapirones. Sorry, I probably said that completely wrong. However, these medications can involve risks as well as benefits. For example, benzodiazepines should be restricted to short-term use only because of concerns about possible side effects of dependency, sedation, rebound anxiety, and memory impairment. Complementary therapies and lifestyle changes. The following has good scientific evidence for effectiveness in helping people with anxiety disorders. Relaxation training involves learning to relax by tensing or relaxing specific groups of muscles, or by thinking of relaxing scenes or places. Recorded instructions are available for free on the internet or can be bought on CDs. Relaxation training is most useful when learned under the guidance of a health professional. There is weaker evidence that acupuncture and yoga may help with some types of anxiety disorders. For further information, see a guide to what works for anxiety disorders in the helpful resources at the end of this chapter. Importance of early intervention for anxiety problems. It is important that anxiety problems are recognised and treated early because they can have major impact on a person's subsequent life. Anxiety disorders often develop in childhood and adolescence, and if they are not treated, the person is more likely to have such a range of adverse outcomes later in life, such as depression, alcohol and drug problems, suicide attempts, lowered educational achievement, and early motherhood. Because of these long-term consequences, it is very important that anxiety disorders are recognised early and people get appropriate professional help. Crises associated with anxiety problems. Crises that may be associated with anxiety problems are: the person experiences an extreme level of anxiety, such as a panic attack. The person has severe anxiety following a traumatic event. The person has suicidal thoughts and behaviours. The person is engaging in non-suicidal self-injury. Panic attack. More than 1 in 4 people have a panic attack at some time in their lives. Few go on to have repeated attacks, and fewer still go on to develop panic disorder or agoraphobia. Although anyone can have a panic attack, people with anxiety disorders are more prone to them. Traumatic event. A traumatic event is one that causes an individual or group to experience intense feelings of terror, horror, helplessness or hopelessness. The person could directly experience the event, witness it happen to others, or learn that it has happened to someone close to them. Most people who experience a traumatic event do not develop mental illness. Others experience symptoms of severe stress and may go on to develop post-traumatic stress disorder or another anxiety disorder or depression. Suicidal thoughts and behaviours. A extreme levels of anxiety are the most obvious crises seen in people with anxiety disorders. However, there is also the possibility of suicidal thoughts. The risk of suicide in people with anxiety disorders is not as high as for someone with other mental illnesses. However, the risk increases if the person also has a depressive or substance use disorder. Therefore, in any interaction with the person with an anxiety disorder, be alert to any warning signs of suicide. Non-suicidal self-injury. Anxiety disorders greatly increase the risk of a non-suicidal self-injury. Non-suicidal self-injury may be a coping mechanism for feelings of unbearable anxiety. Almost 60% of people who engage in non-suicidal self-injury have been diagnosed with an anxiety disorder at some time in their lives. Okay, I'm just going to leave that there for now.